Hi, good morning to all of you. Today I'm going to discuss about pregnancy problems. So this is a part of the child development and psychology. Pregnancy problems here we are mainly going to discuss about two things. One is infertility, and the other is in inherited genetic disorders. This is just an introductory class on pregnancy problems. So, let's start with the definition of infertility. What is infertility? Infertility is basically uh, difficult to attain pregnancy when a couple has been doing sexual intercourse without contraception for a year or two, and they have not been able to attain pregnancy. So it is defined as infertility. So infertility can be of many causes. The causes can be related to the men and to the women. In case of men, infertility is basically because of the low sperm count and low quality of the sperm, or the less mobility of the sperm. The sperm moves too slowly. And in case of females, the problem lies in the ovulation. So um, there are many approaches like how to deal with infertility. Like we have this in vitro fertilization, then we have um, artificial insemination, then we have fertility drugs. So but many couples do not want to get go through these processes and get pregnant because of their a lot of beliefs and traditions. So a lot of religious people like the rabbi also get in touch with the OBGYN and try to uh, come up with a solution. And then uh, so then we have this uh, inherited genetic disorders, like maybe the parents, like one of the parents or both the parents may be having a genetic disorder, inherited genetic disorder, or even if the parents are not having any disorders, maybe one of their close relatives may be having the genetic disorder. So some couples, even before getting pregnant, they would go for genetic counseling. So um, so that they can prevent or they can take any measures so as to have a healthy uh, baby in future. And then usually we see that 9 to 13% of the population have difficulty attaining pregnancy. So it depends, um, like the every case is unique, because it has a huge age range. It can range from the age of the couples can range from age 21 to age 51. And then uh, and the uh, fertility also depends on the age of the men and the age of the women. Usually if the man is above 40 years old and when the women is above 35 years old, attaining pregnancy becomes a bit difficult. And then uh, and then we have we can also discuss about the chromosomal disorders, like with the maternal age. When with the increase in maternal age, there is increased chance of getting chromosomal anomalies, like especially the Down syndrome. And then we have some uh, diagnostic methods and diagnosis, like we can go for ultrasound, then we can go for this amniocentesis and chorionic villus sampling, and then uh, we usually see that the most common one is like the Down syndrome when the maternal age is like above 35, and then it usually happens when the chromosomes cannot separate during meiosis. So uh, these are the screening. These are the prenatal monitoring, prenatal care, like we take to see whether the child is the developing fetus is having a problem or not. So we usually go for ultrasound, then maternal blood sampling, then we have this amniocentesis and chorionic villus sampling. So uh, in summary, like infertility, like as the only consistent thing is that the cases are not consistent, the age range is huge, and mm, and then there are a lot of methods. Some couples want to like go for those processes, some do not want based on their beliefs, traditions, culture, and they have a lot of psychosocial um, and effects on them, like and many couples have like not just infertility, they have those miscarriages, and they feel a sense of loss. So it has a huge impact on the couple, and in some traditions the women suffer a lot because they tend to think the problem is only with the women, and so mm, it's a it's a problem which we should really look into it. And then reproductive endocrinology, that's why the subject, the department, reproductive endocrinologist has uh, been growing rapidly because of this infertility issues, the miscarriages, and the genetic disorders and all those stuff. So this is just an introduction to pregnancy problems. We have a lot more to discuss about it in our future classes, and so this is it for today. So if you have any questions about this, about today's class, you can ask me, and I'm here to answer your questions. Thank you.